instrument. This is known as Kelly's proctoscope. Okay, so it has got two parts. This is called obturator and this is called proctoscope sheath. So it is especially used while navigating through the anal canal to see the internal structures. So what we do is that we position the patient in Sims position, or we can also do it in lithotomy position or knee elbow positions also. So we relax the sphincter and we lubricate the surface of it, and we lubricate the anal area, and we insert the instrument. So while inserting, we insert with the obturator intact in it, and then we take the obturator out, and then we can see through this hole. And it has got two uses. One is therapeutic use and another is diagnostic use. In diagnostic use, it is especially used to see like different piles, hemorrhoids in it, and in diagnostic, those kind of surgery, pile surgery, we can use it. And one precautions or contraindication is that in case of active fissures, we don't use it. If we have to insert it in case of fissures, then we have to do it under GA. So this is our Kelly's proctoscope. So this is our kidney tray, and this kidney-like structure, so you can see here. So this is kidney tray. It has become popular after the universal precaution protocol. So what it does is that while especially transferring sharp instruments, suppose our assistant holds manages to keep blade in it. So this is BP handle. So it comes in. So this is BP handle, and while transferring, suppose it has got blade in it, then we keep it and we hand over this to the surgeon. And another use we can make is that while suppose there is hydrocele, okay, let's say, and then we puncture the sac of the hydrocele, and then fluid comes out. So while draining or while collecting the fluid also, we can use it. And another is, suppose let's say you did appendectomy, or you take out any other pathological organ, then you keep it and you send it to the lab. So this is used for those purposes. So till now we have done two instruments. So this is Kelly's proctoscope and this is our kidney tray. And now we come to the retractors. So these are retractors. We go one by one. So we go from the relatively easier to remember one. So this is L shaped. So you see this is L shaped. L for Langenbach retractor. So you see the blade, it is small. So relatively you see here, these all the blades, they are quite broader in size or shape. So you see here it is smaller in shape. So that's one way to remember it. And you see here it has got hole in it. So this hole is especially designed to keep the instrument light, and it has got broader handle so that we can grasp it adequately. So this is Langenbach retractor. So similar to these structures you can see here. So these two. So okay. These two retractors, so these handle, I presume that these are similar in structures. So you see here on the top it has got ring-like structures. So this is especially Balfour's self-returning retractor. So you can see here, so this is the instrument set. I will be assembling it in a while. So this has got curved retractor in it. I am keeping the Langenbach down here. So this is Balfour's self-retaining retractor, and you can see here it has been already assembled. So you see at the back, so it has got like knot like. So what you do is that you keep it aligned with this seat, so it comes out. So you see, while placing it, you keep it here, and then what you do is that you rotate it at 90 degrees. So these are relatively old instruments, so it is quite tough. So it comes like this, and then it is made like that. And you can see here it can be moved, and it can be moved on another side. However, it is permanent on this side. So this is Balfour's self-retaining retractor. Once again, while doing it, so you take it out, you keep it. You can keep it here also, depending on your demand of surgery, and then you rotate it at 90 degrees. So you see here, so this is being transversal. Now we have another popular retractor. So this is our what retractor it is? devious, isn't it? This is our devious retractor. Let me this here.
Oh, devious. You doing devious.
Devious. So this is our devious retractor. So how you can see here, it has got curved on its above handle. So what we can do is that, so like this way you get a better grip. Okay, and then you see blade, it is sickle shaped, sickle, like a sickle. So that instrument, well, that's just a jokes apart. So this is our devious retractor. Okay, and now this is our Morris retractor. So you see this handle, it is quite similar to Langenbeck, but it has got a hole in it in the middle, but it does not have hole in it. And you can see Balfour's, it has got another hole on the top, but it does not have. So this is Morris, and you can see here its blade, your L-shaped Morris forceps. So you can see, and quite confusing we can get sometimes with this type of retractor. This is Doen's retractor. So you see this is more sort of curved structure. Okay, from the interior also and from the above it is more of curved, whereas it is more of L-shaped. Okay, and it has broader, where you can see this is also L-shaped, but it has got smaller. So these are the retractors. Okay, and this is double L-shaped retractor. So once again on the table I would like to focus it. So once again this is our Balfour's self-retaining retractor. This is the M assembly, and this is the devious retractor, and this is double L-shaped Langenbeck retractor, and you see single L-shaped Langenbeck retractor, and this is Doen's retractor, and this is Morris retractor. Okay, and now
Doen's.
Yeah, this is the Doen's one, which is more of curved, and this is Morris, which is less of curved and L-shaped. Now we come here. So you can see here, this is a long instrument with finger hole in it, and it does not have any ratchet, and on the blade you can see here slight serrations is there. Is it clear? So it has got serrations and it has got a hole in it, so you can see on both sides. So this is especially used to take out the stone from the common bile duct during the open surgery. So this is called Desjardins cholecystectomy scissors. Okay, so what we do in case of open cholecystectomy or open procedures, we navigate and we look whether the CVT has got any stone or not, and we go through it and then we retract the stone. So you see it does not have any ratchet, and it has got serrations and it has got a hole in it. So you can see this also is the Desjardins cholecystectomy scissors. So this is also, so based on the anatomy of the common bile duct, we have different curvatures. So this is curved one, this is more of curved one, and this is obtuse one. And this is our popular instrument, BP handle. So we use it while making the cut. And this is called Mayos towel clip. So it has got ratchet in it, finger holes, and you see it is used for clipping the towel while draping, while making the surgical field. And this is called Ramplay's sponge holding forceps. So you can see here, so it has got finger hole, it has got ratchet in it, and on the top it has got blunt end with hole in it, and on the inside it has got serrations, transverse serrations. So what we do is that while painting, we hold the sponge and then we paint the surgical field area. And another, we can also use it while holding the gallbladder. So these two are nothing but our sponge holding forceps. Okay. Now we have our popular instrument. So this is, so you can see it has got finger hole with no ratchet in it, and it has got a box type of joint. And you see here it is curved one. So here it is beaked and it has got curved blade. Okay. So this is relatively heavier and blunt, and this is called as Seattle's forceps. So we have cylindrical instrument where we keep the sterile gauze, and then we navigate it into it, and then we take it out the sterile gauze piece. So here you can see I would like to make more area here. So you can see here these are also a special type of forceps. So you can see here it has got ratchet in it. Here you can see it has got ratchet, finger hole, and you can see on the beak, you can see here I can feel the serrations. Okay, let me keep it in the light area. So can you navigate the serrations here? So here you can see the serrations. So this is Alice tissue holding forceps. Okay, and one peculiar feature is that, so you see here while making the while navigating it fully, while locking the ratchet, you can see certain gap is seen inside it, isn't it, in the blade. So this is one character of it. So it has got serrations on the blade tip, and this is Alice tissue forceps. So since it has got serrations, it is especially used for holding tougher structures like fascia and scalp epidermis. So you can see here, so these two are dissecting forceps. So you can see here it has got serrations. So while handling, because the surgical field it is bloody and fluidy, so it may slip. So for that it provides the greater grip. So there it has got serrations, and you see here one it is tooth and another it is non-tooth. So you can see my finger, one it is tooth one and another, so it comes like interlocking this way. So since it is toothed, so toothed type it is used to hold tougher structures like fascias or anything like that. So this is tooth tissue forceps, and this is non-tooth tissue forceps while dissecting relatively fragile structures. So here we have our scissors. So you can see it does not have ratchet, it has got screw joint in it. So most of the scissors they get screw joint, and you can see here the one is curved one. So you can see here, so if I keep it aligned like this way, so this one is curved and this one is straight blade, and the blade it is blunt, so it is Mayo's straight and curved scissors. And now you can see here it has got finger hole in it. So this is finger hole with a ratchet in it, and now you can see it has got box joint. So in the tip it has got very peculiar feature. So you can see here it has got serrations. So these serrations they are like crisscross type. So suppose you see, so if this is one blade, then this is going obliquely like this finger, it has got like these serrations, and another it has got like this oblique serrations. So these serrations they come in crisscross contact, and you can see here you can navigate it or not. So you can see here there is a groove in it. Is it clear on the video? Yes. So you can see it has got a groove in it, and this is called as a needle holder. So while stitching, so needle is kept hold with it, and then we tie the sutures. And this is also one of the very popular instrument. It has got finger hole in it, ratchet, sang, and it has got box type of joint. And you can see on the tip end of the beak, so you can see it has got curved from both sides. So one curve from this side and one curve from this side, and you can see there is a hole on both the curve. Okay, so this is especially used to hold tubular structures. This is called Babcock's tissue holding forceps. So this is especially used in case of like appendectomy, so while holding the appendix. And one peculiar feature it has got is that, so while you hold the tubular structure, and certain like outmarkings of the tubular structures come from this hole, so that there won't be strangulation. So this is Babcock's tissue holding forceps, especially used to hold the tubular structures like fallopian tube, ureter, and appendix. Now we come to the forceps. We will go from simple type. So this is our, you can see here. So you can see here it has got finger hole in it, ratchet, and this is box type of joint, and it has got blade. So in this blade you can see here So it has got is it clear? So it has got transverse striations, you see, across the blade. Okay, so this is what it is, that it is Kelly's hemostatic artery forceps. Okay, so this is our hemostatic artery forceps. So this is medium sized one. We can find it like long type of, so you see here, so this is your long hemostatic artery forceps, and this is curved. So one peculiar feature what we can find is that suppose this is also so you see here, so these two are hemostatic artery forceps. Sorry, this is not okay, let's this one. So this is straight bladed artery forceps, and this is curved one. So straight type of artery forceps, they are especially used in case of narrow structure. Suppose this is our narrow structure, and while navigating it here, so straight type of instrument is used. Suppose we have got a better field, and but we have to be cautious where we are going, then we use curved, so that we can see from the another angle. So curved way we go, and then we clip the artery, or like we can hold, suppose let's say we are doing appendectomy, then what we do, we grabs the base of the appendix, and then the lumen, it is crossed. So while crossing also it can be used, and these are the artery forceps. So you can see here, this is a straight one, this is slightly curved one. Here you can see it is 90-degree bend, and it has got a special name which is called mixer's artery forceps. So mixer's, it is 90-degree bend. Here also you can see stout one, which is 90-degree bend. Now we can see here these two instruments, these are relatively smaller in size. So when you compare these three as a whole, so you see here, so these three, they all are artery hemostatic forceps. However, you see this is relatively smaller one. So this is popularly known as mosquito forceps. And you can see here, these also come under two category. One is curved one, and another you see it is straight bladed. So it has got racet, finger hole, shank, box type of joint, and it has got curved. And while holding, so you can hold it this way. So you can see here my thumb finger is navigating here, my ring finger is here, and you put your index finger here and mid finger providing a adequate grip. Now we come here, this is also artery forceps. Now we have here two special instruments. So you see here, these look like similar to hemostatic forceps, isn't it? So they have got box joint. So this is our hemostatic forceps, but it has one difference in it. So you can see here in the beak, so this is your blade. So you see blade, it has got tooth-like structures in it. So is it clear in video? Yes. Okay. So it has got like these structures. So you see that. So while navigating it, it goes like this. So it is also dissecting forceps. It also has got that like of tooth structures. So this is also artery forceps, which has got tooth-like forceps. So this is Cocker's artery forceps. So it was previously used extensively for thyroid surgery, for holding the superior pole of the thyroid. So this is Cocker's forceps. So till here it has been clear. Now you see here, so I have these three instruments. Okay, let's say these four instruments. So you see here, these all instruments, they have got finger hole, they have got racet, they have got box type of joint, but there are certain difference on the blade. So you see here, this blade, it has got transverse striations. So striations, they are going this way. So is it clear on the video? So you see these striations, they are going transversely. Okay, suppose if this is my blade, these are going like this way, striations is going this way. Okay, not along the length of this blade, it is going perpendicular. Okay, but you see here it has got striations, but these striations, they are going vertically. Is it clear? Yes. Okay, so suppose this, my finger is this blade, so the striations, they are going in this direction. Suppose this is going in this way. Okay, so this is bowel holding forceps. Okay, so in case of bowel resection or suturing, so this type of forceps is used. So this is curved one, and this is also curved one, and this is also got vertical serrations in it, and this is straight blade, and it has also got vertical serrations in it. So don't be confused with this bigger type of hemostatic forceps. So these are got vertical, these are got transverse serrations. It has got vertical serrations. So yes, this much. One quick recap. So this is Kelly's proctoscope. This is kidney tray. This is Belfort self-retaining retractor, and this is the alignment. And you can see here, this is the devious retractor.
Morris.
Here, this is the Morris. This is devious. Okay, so these three, this can be quite confusing. This is Morris. This is Duane's, and this is devious. And this is
Belfort's.
Okay, once again, quick recap. This is Belfort's. This is devious. This is Morris. This is Duane's. And this is double lancet Langenbeck. And this is Langenbeck only, single lancet. So you can see here,
Desjardins.
this is Desjardins Cholecalciferomy scissors. So it has got serrations. And this is Badpacker's handle. This is Myers towel clip, and this is Ramplay's sponge holding forceps, and this is Cheetor forceps. These all are Ellie's tissue holding forceps, and these are tooth and non-tooth dissecting forceps. This is Myers straight, and this is curved one. This is needle holder, crisscross and groove in it, and this is Babcock's tissue welding forceps, and this is Cocker's forceps. This is longer one, and these are RT homeostatic forceps. This is mosquito curved one, and here we have mosquito straight one, and these are mixtures 90-degree curved hemostatic forceps. This is straight, these are curved one, and you can see here it has got vertical serrations. So this is bowel holding forceps. So
and that's it.
And I myself, Amrit Basal, final medical student from NHS, and I